Welcome back to our course in inflammation. Today we're going to talk about all the conditions that inflammation can cause in your body. So let's talk about heart disease and stroke. Remember, there is something in the world called metabolic syndrome, and that is the name given to heart disease, diabetes, cardiovascular problems, and blood lipid disorders. So heart disease and stroke fall into this because we have too much of that visceral fat. Remember, that visceral fat is the fat that wraps around your tummy that causes inflammation by putting cytokines into your body, which we don't want to have. So we need to reduce that. The Metabolic Balance Program is a program designed specifically to reduce inflammation by giving you a customized and individualized program. Next, we have type 2 diabetes. Type 2 diabetes is definitely a form of inflammation. You see, your cells need to receive sugar, but if your diet is really high in sugar, your cells become insensitive and you can develop type 2 diabetes. And type 2 diabetes is reversible and it is preventable, so we need to make sure that we have a diet that's going to give you low glycemic foods and high biological value. So you want to make sure you don't consume too many sugary foods. So lots of fruit, lots of vegetables, so that you don't have type 2 diabetes, and exercise manages that as well. Cancer is also one of the conditions that is related to inflammation. And remember, cancer loves an acid body and cancer loves sugar. And consuming too much sugar on a regular basis is setting the ground for the body to possibly have cancer. So we want to make sure that the diet is clean and the water is clean as well. Asthma and lung problems, these are all inflammation which cause red, swollen bronchial tubes, making it very difficult to breathe. So make sure that even in your house, you don't have a lot of candles that are the chemical candles. The best candles to have in your house are beeswax candles, and to make sure you're getting outside to absorb lots of great oxygen and fresh air. Next on here, we have Alzheimer's. Now, Alzheimer's is inflammation of the brain, which is associated with memory loss. When I was growing up, there was a lot of aluminum cookware, and they now know that ingesting food that's been stored in aluminum containers has been related to Alzheimer's, but it's an inflammation of the brain, and we can manage that by changing the diet as well. Joints, so we know that when you have rheumatoid arthritis or even an autoimmune disorder, it's going to settle into your joints. And remember, this is a buildup of acid in your body, and the way you get rid of acid in your body is either you breathe it out, you poo it out, you pee it out, or you hold it into your joints. So we know that even with this, there are foods that cause more inflammation, and these are inflammatory foods, and you want to have a diet that is less inflammatory. So a diet that's got more fruit, more vegetables, and more clean water, because joint pain is a big problem for a lot of people, and taking medication isn't necessarily the solution to managing joint pain. So any type of arthritis, there are 4 foods that make it worse, and that are the nightshades. That's potatoes, tomatoes, eggplants, and peppers. And believe it or not, nicotine is also a nightshade product. Your gut health is really important to maintain because you have good bacteria. So from your mouth to your bum, you have 80% good bacteria and 20% bad bacteria. But if you're eating a diet that's high in sugar, high in processed foods, you're going to wipe out all that good bacteria, and that's going to lead to all kinds of problems, particularly constipation, fatigue, and even like diarrhea and those sorts of things. Your sleep, it's important to make sure that we get 7 to 8 hours of sleep every night. But if you're eating a diet that's pro-inflammatory, and we're going to talk about later what you can do for it, your sleep is going to be disrupted. So make sure that you're having 3 meals a day. Make sure that you're starting your meals with 2 bites of protein, because that's going to stabilize insulin, and that's going to allow you to have a really good sleep at nighttime. Then we have damaged gums. So your gums, if they start to bleed, this is an inflammatory response, and you know you need more vitamin C. So bleeding gums is a sign of inflammation, and even when you go to your dentist, that plaque builds up around the gum line, and this is why it's so important that we go get our teeth cleaned, because you don't want the wrong bacteria in the mouth or the wrong bacteria in your gut, because it's all going to create that inflammatory response. Weight loss. Sometimes with weight gain and weight loss, it's all a sign of inflammation. So you want to make sure that the body maintains its weight and to not fluctuate too much. So if you want to lower your inflammation, you do need to lose weight. And again, you always come back to the size of your belly. If your belly measures more than 35 inches for a female or 40 inches for a male, you have too much of that visceral fat, and that fat is leading to inflammation, which is going to find a home in the body. So you have to make sure that we maintain the weight. And again, the Metabolic Balance Program is the fastest growing program out there that helps people to manage weight, to lower inflammation, and to balance out your hormones. Damaged bones, well, your body is supposed to operate in an alkaline environment, and as we get older, our bones become a little bit porous, and often it's because we're consuming too many of these processed foods, which leaches calcium, magnesium, potassium, and sodium, and the bones can become brittle. So it's important that your diet is rich in these minerals, and our diet is deficient of these minerals because of the overprocessing. Remember, if food has to pass a chemistry lab on the way to your mouth, it's going to be probably depleted of the necessary minerals that we're looking for. And also, when it comes to your bones, you want to make sure that you're getting enough vitamin D and enough calcium to stay. And taking a vitamin D supplement up to 5,000 milligrams a day does lower inflammation, but we'll talk about steps in which you can improve your inflammation. Fatty liver disease, well, fatty liver disease is on the rise. It's affecting 100 million people and is the fastest growing liver disease in children. And the reason we have it is we have too much processed foods and we have too many sugary drinks, which is raising insulin, which is a fat storage hormone, and your cells in your liver are like balloons and they absorb fat. And once they absorb fat, the liver becomes full of fat and it's a silent killer. So we need to make sure that we do not develop it. It's actually taking over right now. It's in the next 20 years, it's going to probably be a huge problem, but it's completely manageable through a proper diet, which we'll talk about a little bit later. Your skin also, if you have inflammation, you might find you have eczema, psoriasis, rosacea. These are all signs of inflammation, so it's usually the gut health is not healthy and the gut bacteria is off and you're eating foods that are causing that. And remember, there is a test that you can do, and which I do in my practice, which is called an IgG test. And this IgG test basically looks at over 200 foods that are causing inflammation in the body. So, and most people consume the same 11 foods every day, and by not consuming these foods and taking them out, you can lower your inflammation. So these are just a few things that inflammation causes in the body. And remember, we're all looking and we're all striving for optimal health, because my belief in life is that you should feel amazing, 10 out of 10 every day. You should have lots of energy. You should have no aches and pains. But remember, when that light on your dashboard in your car comes on, you take it to the car dealer. But when the light in your body comes on, we often ignore the signs and symptoms, and the red, hot, swollen, carrying that extra tire around your stomach, and developing any of these are all signs that the body's out of balance. And in the next video, we're going to talk about what you can do for it. So thanks for joining me.